Please can you present your findings?
So I believe that this patient has had a double lung transplant. I've come to this conclusion from the clamshell incision that she has throughout the front of her chest. She also has evidence of 5 intercostal drain site scars, 4 on the front and 1 on the back. In inspection of the neck, she has evidence of a previous tracheostomy and central line insertion. I do currently believe that the transplant is working well, as she does not have any evidence of central or peripheral cyanosis, and she's not requiring any supplemental oxygen therapy. She does have evidence of transplant rejection medication usage through a tremor on inspection of her hands. As to the underlying etiology of the condition, I cannot be certain, but there was possibly evidence of clubbing on inspection of her hands, which may lead to the underlying etiology being bronchiectasis or pulmonary fibrosis.
Is there anything else that you would have liked to have done when examining this patient?
Particularly, I would have liked to examine this patient's lymph nodes.
Okay, so can you tell me about the commonest indications for lung transplantation?
So the commonest indications for lung transplant is through patients with CF, cystic fibrosis, or bronchiectasis. Patients can also have a lung transplant for pulmonary vascular disease or forms of pulmonary fibrosis.
Can you think of any other indications?
COPD would be another indication for lung transplantation, but in general they are single lung transplants as opposed to the double lung transplants that you would see in this case.
So what would be the usual indications to do a double lung transplant? Why would you choose to do a double over a single lung?
The prognosis from a double lung transplant as opposed to a single lung transplant is greater. Normally, patients with cystic fibrosis and patients with bronchiectasis would receive a double lung transplant, and then there are some indications sometimes as to why patients with pulmonary vascular disease or pulmonary fibrosis would receive a double lung transplant as well as opposed to a single.
Okay, can you tell me a bit about the medications that can be used in lung transplantation?
So patients in lung transplantation are generally on a combination of anti-rejection medications. Normally it's a combination of tacrolimus, mycophenolate and steroid therapy. Cyclosporin is something that was historically used but is less commonly used now because of the risk of renal failure.
Can you tell me about some complications or potential complications of lung transplantation?
So in the acute phase, there's hyperacute rejection of the lung transplant. There's also evidence of opportunistic infections that can cause damage to the transplant. And then as time progresses, patients become increasingly susceptible to bronchiolitis obliterans, which is usually a terminal event.
Do you know of any contraindications to lung transplantation?
So contraindications of lung transplantation would include patients with malignancies within the last 5 years, patients with particularly high or low BMIs, patients who are currently smoking or using illicit drugs, patients with mental health conditions that would preclude them from taking medications on a regular basis or regularly being able to turn up to any clinic appointments.
Okay, thank you very much.
Thank you.